Assalamualaikum and good day everyone, and especially to our teacher, hello ma'am, and my classmate, hello everyone. And then I would like to introduce myself. So hello, I am Walid Lominog, currently studying Bachelor of Science in Nursing at the College of Health Sciences. So today I'm gonna report the Ebola virus, which actually given to me or assigned as my report disease. Ebola virus disease is a severe, unusual fatal illness in a human and other primates caused by the Ebola virus. The condition, which was formerly referred to as Ebola hemorrhagic fever, has a high risk of death, killing between 25% and 90% of people who are affected. In 1976, the disease was first identified in two simultaneous outbreaks, one in Zara, a town in South Sudan, and the other one is Yambuku, Democratic Republic of Congo, a village near the Ebola River, from which the name of the disease was coined. So, the largest and more complex epidemic outbreaks of these conditions occurred in 2014 to 2016. In some part of West Africa with 28,616 cases and 11,310 deaths actually. The outbreak mainly affected three countries in West Africa: Liberia, Guinea, and Sierra Leone. Some cases were reported in some part of Central Africa. Ebola virus disease spread between these countries, starting in Guinea and then moving across land borders to Sierra Leone and Liberia. So the symptoms of this disease or this Ebola virus disease may include the sudden onset of high fever or high temperature, vomiting, diarrhea, then headache, muscle pain, abdominal pain, fatigue, skin rashes, red eye, bleedings. Some patients may experience rashes, red eyes, difficulty swallowing, difficulty breathing, bleeding inside and out of the body, cough and hiccup. Mode of transmission of the Ebola. Ebola is thought to be a zoonotic virus. This means that it originates animals and then spreads to humans. Fruit bats are considered as the natural Ebola virus host. Ebola virus enters the human population through contact with blood, secretions, organs, or other bodily fluid of infectious animals like monkey, fruit bat, gorillas, and baboons. It then moves from person to person, the same way bodily fluid that may contain the virus, including tears, saliva, semen, breast milk, sweat, mucus, urine, and feces. The entry points for the Ebola virus include mouth, nose, eye, open wounds, cuts, and abrasions. According to the World Health Organization, only people who are seriously sick can spread the conditions through saliva after recovery. Ebola may occur in breast milk, therefore it is not known when it's safe to breastfeed again. And the infection can also be transmitted through contact with surfaces and objects contaminated with the virus. The Ebola virus may persist in the semen for many months after or even after recovery, leading to the infections via sexual intercourse. Based on the present evidence, the World Health Organization recommended that all Ebola survivors and their sexual partners should receive counseling to ensure safety practice until their semen has twice tested negative. And death body remain infectious. People who are at high risk may include people who prepare death. Ebola patients for funeral health workers who are treating infected people, family members, or close relatives of people who are infected symptoms. Causative agent. Ebola virus disease in humans is caused by an infection within a virus of the Filoviridae family genome Ebola virus, and a family of a single stranded negative sense RNA virus in the order Monogoviralis and kingdom of Orthorhynaviridae. 5 species of the genome Ebola virus has been identified: the Zaire, Sudan, Thar Forest, Bundibugyo, and Raystown. The fatality rate of Ebola varies depending on the strain. Zaire Ebola virus is the most dangerous and it is the responsible for the largest outbreak. This strain can have a fatality rate of up to 90%. Ebola Raystown has never caused fatality in humans but has caused disease in other primates. Medical management or treatment. So the treatment is no proven treatment options are available for the condition, though the researchers are working on it. There are 2 treatments which have been approved for treating Ebola, actually found on July 28, 2001. So the number 1 in this treatment medicine is actually first is the Inmazib, is a mixture of 3 monoclonal antibodies, which is the Antoltibimab, Maftibimab, and Odisibimab. And then the number 2 is Ansovimab, Zicol, Ibanga, is a monoclonal antibodies given as injection. The symptoms of Ebola are managed with oral or intravenous fluid, oxygen, blood pressure, medications, blood transfusions, and lastly, treatment for other infections. Prevention and control. The Ebola outbreak in West Africa is over if you are traveling to these areas. It is actually advisable to follow the sample procedure, like avoid physical contact with people showing signs and symptoms such as continuous high fever, red eyes, vomiting, and stomach ache. And of course, wash your hand regularly with soap and clean water. And then do not shake hands with the persons showing signs of Ebola virus. And keep away from bats, monkeys, baboons, and dead animals. And avoid bats meat eating raw meat of the dead animals and handling dead animals. Incubation period of the Ebola virus. The incubation period, or the length of time from infection with the virus to onset of the symptoms, is between 2 to 21 days. The drug of choice of Ebola virus. No Ebola virus disease specific treatment exists in this world. Treatment is primarily supportive in nature and includes minimizing invasive procedure, balancing fluids and electrolytes to counter dehydrations, then administrations of anticoagulant early in infections to prevent or control disseminated intravascular coagulations. So administration of the procoagulant late in infections to control bleeding, maintaining oxygen level, pain management, and use of medications to treat bacterial or fungal secondary infections. Early treatment may increase the chance of survival. So the diagnosis of the Ebola virus is to make a diagnose other condition will first be ruled out. It should be noted that sample and specimens from patients with Ebola are extremely biohazard. Risk testing should therefore be conducted under maximum biological containment condition. Okay, the several tests that may be used to make the diagnosis include antigen captures, enzymes linked immunosorbent assay or ELISA testing, virus isolations by cell culture's electron microscopy, and polymerase chain reactions, and IgM ELISA. That actually the things that we can use to taste the Ebola virus. And thank you so much.